Blood is a constantly circulation fluid providing the body with nutrition, oxygen and waste removal. Blood is mostly liquid, with numerous cells and proteins suspended in it, making blood thicker than pure water. The average person has about 5 liters of blood. Blood is conducted through blood vessels. Blood is made up of liquid and solids. The liquid part called plasma. It is made up of salt, water and proteins. The solid part of our blood contain red blood cells, white blood cells and platelets. Plasma contains proteins that help blood to clot, transport substances through the blood, and perform other functions. Blood plasma also contains glucose and other dissolved nutrients. RBC which carry oxygen to the tissues. WBC which fight infections. Platelets, smallest cells that help blood to clot. Blood cells are made in our bone marrow. This process is called hematopoiesis. Types of blood disease. Hemorrhage, bleeding, blood leaking out of blood vessels may be obvious as from a wound penetrating the skin, internal bleeding. Hematoma, a collection of blood inside the body tissues. Internal bleeding often cause a hematoma. Leukemia, a form of blood cancer in which white blood cells multiply abnormally and circulate through the blood. The abnormal WBC make getting sick from infections easier than normal. Multiple myeloma, a form of blood cancer of plasma cells similar to leukemia. Anemia, kidney failure and high blood calcium levels are common in multiple myeloma. Bacteremia, bacterial infection of the blood. Infections are serious and often require hospitalization and continuous antibiotic infusion into the veins. Malaria, infection of red blood cells by Plasmodium, a parasite transmitted by mosquitoes. Malaria causes episodic fever, chill and potentially organ damage. Thrombocytopenia, abnormally low numbers of platelets in the blood. Thrombocytopenia may lead to bleeding. Leukopenia, abnormally low number of WBC in the blood. Leukopenia can result in difficulty fighting infections. Disseminated intravascular coagulation (DIC), an uncontrolled process of simultaneous bleeding and clothing in very small blood vessels. DIC usually results from severe infections or cancer. Hemophilia, an inherited deficiency of certain blood clotting proteins. Uncontrolled bleeding. Myocardial infarction, commonly called a heart attack, occurs when a sudden blood clot develops in one of the coronary arteries, which supply blood to the heart. Lymphoma, a form of blood cancer in which white blood cells multiply abnormally inside lymph nodes and other tissues. The enlarging tissues and disruption of blood functions can eventually cause organ failure. anemia, an abnormally low number of red blood cells in the blood. Hemolytic anemia, anemia caused by rapid bursting of large numbers of RBC. An immune system malfunction is one cause. Hemochromatosis, a disorder causing excessive levels of iron in the blood. The iron deposits in the liver, pancreas and other organ, causing liver problems and diabetes. Sickle cell disease, a genetic condition in which red blood cells periodically lose their proper shape. The deformed blood cells deposit in tissue, causing pain and organ damage.